It's like a new lease on life.
Help for Hoosiers who cannot physically leave their homes. A new program is using paramedics to bring the vaccine to people who cannot go out and get it themselves. Good evening, everyone. I'm Brooke Martin.
And I'm Phil Sanchez. Thank you for joining us tonight. The Homebound Hoosier program already has more than 1,000 names of people ready to get their shot. Wish TV's Dan Klein joining us now live to explain how it works, Dan, and how people can sign up.
And the program is getting some nationwide attention for the way it's using paramedics to connect with people who cannot physically leave their homes. And for those in need, it's a life changer.
Hi, it's Susie with Homebound.
A Hoosier in need is getting some help this week. Larry, one of the first in the state to have the vaccine come to him. He's too sick to be able to leave the house. Now that can all change for himself and his wife, Sandy.
We can have our grandkids come in. Still need to be careful, I know, and wear our masks and everything, but
a mask and a visit is better than no visit at all. The Homebound Hoosier program connects eligible men and women with doses of vaccine which might otherwise be wasted because of canceled appointments or no-shows. There's just a 6-hour window for giving the vaccine once it's opened. But instead of calling people on a standby wait list, clinics will now call paramedics to deliver the dose to people who cannot leave home.
EMS wants to be a part of the public health environment, and they want to deliver community services to their patients.
An estimated 2 million Americans are unable to leave their homes, but they're still vulnerable thanks to healthcare or other essential workers who come to them.
This is super important for our community, and it is a relief to these folks.
They are very vulnerable, and that's why we have to find a way to get the vaccines to them at their homes.
Relax your arm.
For now, in Indiana, it's limited to people who are already verified for some type of homebound service and eligible vaccine recipients, which is currently 60 and up. Already, 1,200 people have signed up statewide, with more expected. The setup has been shared with others as a model.
It has gained national attention, and we're proud that we can do something to service this population.
A population with a new outlook on life at home.
we're just grateful that you guys came out so quickly and gave Larry his vaccination.
Thank you.
To register for the program, call your local agency on aging. That 800 number is on your screen right now. Again, Hoosiers must already receive some type of homebound service through FSSA so they can be verified. And it is also limited, for now at least, to people who are 60 years and older, though that will expand as it does with the general population as it expands throughout Indiana in coming weeks and months. Reporting live outside the State House, Dan Klein, Wish TV, wishtv.com, and be sure to follow us on Facebook.
Thank you very much. State health officials say they are letting the data drive their decisions for vaccine eligibility, with Hoosiers in their 60s now able to get the vaccine. The next group will be those in their 50s or with one of 5 health conditions, like organ transplant recipients who are at a greater risk of dying or being hospitalized. The governor was asked today again about teachers. He says he's looking at health conditions, not professions.
It's like, I'm not going to cut in line. The professions don't put you in a higher risk as the information that you've supplied me. It's actually the age and your comorbidity. So we'll continue to go down that path. When the supply is there, I hope they turn out in droves.
State health officials say they've recovered from last week's supply chain issue from the winter storm and are expecting 247,000 doses of vaccine this week.
Well, the U.S. Food and Drug Administration says Johnson & Johnson's COVID-19 vaccine has met its requirements for emergency use authorization. It has not yet been approved for public use. An FDA advisory committee will meet on Friday and make a recommendation. According to the FDA, this vaccine is about 70% effective at protecting against severe COVID-19 infection at least 14 days after vaccination. That drops to 66% at least 28 days after vaccination. Those rates are not as high as vaccines from Pfizer and Moderna, but Johnson & Johnson's vaccine only requires 1 dose. The FDA's analysis says the agency found no specific safety concerns with the vaccine.
Indiana University is planning to have in-person classes this fall. President Michael McRobbie announcing today that the school expects to return to mostly normal operations by then. IU, like colleges across the country, moved many classes online over the past year due to the pandemic. McRobbie says the school will likely still have some COVID precautions in place in the fall, but that everything will depend on how things are in the state and how many students and staff have been vaccinated.
Well, community leaders across the state are making sure Latinos get the information they need about vaccines. Wish TV is the media partner for the Indiana Latino Institute's virtual town hall discussion on COVID-19. The event is tomorrow from 6 to 7 in the evening. You can watch it live on wishtv.com and on our Facebook page. It will be in Spanish and consists of a panel of community experts who will answer your questions about the benefits and misconceptions about the vaccine.